Hi, I thought I'd just make a short video of things that might help you when you get home and just what I've found to be quite useful. So when you're discharged from hospital, you will have 2 crutches. They may even offer you a walking frame or Zimmer frame. If you can get away without using the Zimmer frame, I think the crutches will get you back walking sooner because you're using more of your own weight, and that's really good to do weight bearing exercise, just to make sure the bones are nice and strong. But that's only my opinion. I was given the crutches, and I've got a left and a right one, whereas when I broke my leg years and years ago, they were just a pair of crutches that you could use either side, but these are actually quite comfortable to use. So I don't know whether you actually have to purchase these yourself or whether you're given them, but well, I was given mine, and I'm getting along quite well with them actually. I'm trying to walk with them as much as possible, just because obviously you are at risk of DVT after an operation, so it's good to keep as mobile as you can, just to keep the blood flowing. So the next thing I was given was a raised toilet seat, which I wouldn't have managed without it. You literally are not allowed to bend. You have to make sure that your bum is always higher than your hip, otherwise you risk hip dislocation. And I was given a brand new raised toilet seat, which has been invaluable. I don't know what I'm going to do if I go out and about on my crutches and I need the loo, because I won't be able to use it, because I do still need the raised toilet seat. I'm supposed to use it for 6 weeks until I see the consultant. I'm guessing they'll take an x-ray again and then say, right, fine, you're okay to go lower. But they're really, really easy to fix on. It took my husband took him about 30 seconds. And I think I will probably just put it back in its box when I finish with it, and put it in the garage just in case I should need it again. Hopefully not, but you never know. Right, the third thing is one of these, a grabber. I think you could probably pick them up on eBay. I guess you might be able to get them through like litter picking tool. I was given one of these, again, it's like a crocodile. My dogs are absolutely terrified of this. It does take some practice. I still can't put my own socks on, and I've just about learned how to put my own underwear on and take it off again with this tool. But it's invaluable. Again, you cannot bend down. You must not bend down. So get one of these. They're really inexpensive, and it will stop you trying to do something that you're actually advised not to do too soon. So that's my third thing. My fourth thing was I was also given a really, really long shoehorn. I haven't got it with me at the moment because I still haven't fathomed out how to actually use it. My feet are so swollen at the moment. Both my legs are. Obviously the operated leg is still very swollen after 2 weeks. The right leg that I didn't have anything done on is also a little bit swollen. So I haven't been able to put anything on my feet apart from slippers and some sort of loose Skechers plimsolls. Perhaps when I actually get back to wearing shoes, the shoehorn might come in handy, who knows. The next thing is a kind of a V-shaped pillow. I put that around my neck at night because I'm having to sleep on my back, which I'm finding really uncomfortable. It just kind of positions me so that I'm not tempted to roll over or anything. I'll show you a picture in a minute. But also downstairs, It just gets me comfortable in the chair. I'm still having to sit on raised cushions, but if I lie along the settee, I just find it supports my neck, because if you're kind of sitting in an unnatural position, your neck suffers. And the first couple of nights when I didn't have it, I woke up with a real sort of stitch pain in my neck. Let me have a look. What have I written down for my other ones? Oh yeah. Ice pack. Not everybody's got an ice pack, but most people have frozen peas. Frozen peas are the best frozen vegetable because they're small and they're easily mouldable against you. And if you just make sure that you put it in a plastic bag, mark it whatever you want to mark it, so that you don't actually end up cooking them, because you'll be getting them out the freezer, putting them back in, getting them out, thawing them and freezing them. They're not really going to be very good for cooking afterwards. But they are really good, just to help numb the area if you're in pain or you have got very swelled up hips. Right, the next thing is bio oil. Bio oil, I don't know what exactly it's got in it, but it is really, really good for scar tissue. To be honest, I don't mind having the scar where it is. I've got a good 10 inches, 8 to 10 inch scar. And to be honest, I'd rather have the scar than the pain that I had before my hip operation, so it doesn't bother me. However, bio oil is really, really good for helping heal and for helping reduce scar tissue. So if you can get to Boots or Superdrug, I think Amazon do it as well, and get some, it's well worth it. Just put a couple of drops on every day, and that will assist in the healing process, and it will also help heal with minimal scarring, one hopes. All right, my last thing is just tips on your skin. I am a skincare expert in so much that I do. I'm a beauty therapist, so I know all about skin. And I know that a general anaesthetic is going to beat the hell out of your skin. If you're taking oxycodone or any kind of codeine tablet, it will dry your skin out. You will end up with dry lips. So I've been using a Boots No. 7 lip care product that you put it on and it's supposed to hydrate your lips for 24 hours, although I tend to apply it a couple of times a day, and it's really, really helped. Also, with your skin, make sure you use a really, really good night cream. Like I say, a general anaesthetic beats the hell out of your skin. You need to put as much moisture back into it as possible. And the other thing is, when I first came out of hospital, because I was really sore and I didn't want to move around, I didn't drink. And because I didn't want to have to keep getting up to go to the loo, basically. But you need to drink lots of water to avoid constipation, because the oxycodone, sorry, it's pulled up outside, no, the oxycodone will make you constipated, so will codeine. I mean, I was given some Senna tablets and I've only had to use them once so far. I've decided to hell with it now, moving around more easily. I'm going to up my water intake. Prior to the operation, I was a 2 litre a day girl because it did my skin the world of good. And I just think it really, really helps your general health overall. I can't stress getting enough water because it's horrible being constipated, and it makes you feel miserable. So just make sure you get plenty of fluids. My other tip was that they advised me when I came out of hospital to sit on a chair rather than a settee, because the settee kind of goes back and you'd be at the wrong angle. I tried sitting on a chair and it was so uncomfortable. So I have piled up cushions on the settee so that I'm sitting quite high up. either that or I lie lengthways on the settee with my V-shaped cushion to support my neck. My scar is mainly on my butt, so because I'm laying on my back all the time, I'm laying directly on the scar, and it does get quite sore. But because my dressing, I had a non-waterproof dressing, so it was on for 2 weeks and I took it off. Because I want the scar to air and to heal quickly, I'm loath to actually put padding on there, if you know what I mean. So I'm yet to find a comfortable way of laying on it. But there we go. So I hope that's helped a little bit. I'm now 14, 15, 16 days after my operation. The first 2 weeks was hell. I thought, what the bloody hell have I had this done for? This is awful. That didn't last. Now I'm so glad I've had it. I am still on 4 doses of oxycodone a day, because if I don't take it, my hip just screams at me. I was unfortunate enough to have extra surgery, in so much that my the ball and socket joint, the joint the ball goes into, was very, very shallow, causing my hip dysplasia. The surgeon had to ream it and make it a lot bigger, and he also had to wedge the ball joint in, and he had to pin it. So it's taking probably me a bit longer to get over it than if you just had a normal, what is normal, routine hip replacement. So I am relying on the painkillers. I know they can become quite addictive. I don't think I will get to that stage, hopefully. I'm just not ready to let my hips scream at me 24/7. And I said in my previous videos that I was told at my pre-assessment and throughout my operation that I mustn't let my pain level go high, because it'll be hard to get it down. When you're not in pain, you recover better. When you're in pain, your body lets off cortisols, which impair healing. There's all sorts of reasons why it's good to take the painkillers if you need them, and I'm just taking what help I can get at the moment. I've set myself a goal that, I don't know if I should set goals, but I thought in 6 weeks' time from the operation I'd be back to work. I now realise that was way off the mark, so I'm hoping to be back on 2 feet by December. But if it takes longer, it takes longer. I'm not going to rush it. I waited a long time for this operation. I'm going to take it slow. I'm going to do everything that I'm told to do. I'm doing all my physio, so I'm just playing it by the rules. Anyway, I hope that this has been helpful to you. Please feel free to share or to subscribe to my profile or my sub on YouTube, because I've got other videos. I'm kind of doing a vlog throughout my recovery. So thank you very much. Bye-bye.